Hi, I'm Monica Petrozelli, and welcome to Disability Advocacy Weekly, your weekly update on the issues affecting Americans with disabilities. Each week, we will review the top national stories and local issues making headlines in the world of disability advocacy and provide resources that empower you to help make a difference. Our weekly video coverage in podcast format can be found on our website at www.disabilityadvocacyweekly.com. The U.S. Department of Education's Office for Civil Rights found that the Oakland Unified School District discriminated against a student by subjecting him to inappropriate and excessive restraint and seclusion. The decision stems from a complaint filed by Disability Rights California on behalf of a boy with autism. The 9-year-old student with autism attended the Inova Center of Education in Concord. The student was restrained 92 times over an 11-month period to control his behavior. The practice included 2 to 3 adults holding him face down for up to an hour and a half at a time. Under a settlement agreement, the Oakland Unified School District agreed to no longer contract with schools that use prone restraint and to develop protocols and education programs to monitor and teach staff positive behavior interventions. In Texas, an estimated 280 people are being represented in a class action lawsuit brought against the state health department by Disability Rights Texas. All of these people have disabilities and are sitting in jail awaiting treatment after being declared incompetent to stand trial, the suit says. The class action lawsuit argues that individuals found mentally incompetent to stand trial have been held in jails rather than in state mental hospitals for lengths of time that violate their constitutional rights. According to the Treatment Advocacy Center, their situation is the norm for mentally ill people awaiting trial in the state. Texas is among the states with the lowest number of public psychiatric beds and among the stingiest states in per capita mental health spending. In 2014, the average wait time for inmates needing a spot in a state mental hospital was about 20 days, according to the Dallas Morning News. Now the number of mentally ill inmates and wait times has skyrocketed. By April, the average wait for a maximum security bed was 122 days. In Joplin, Missouri, local sheltered workshops expressed concern over the future of jobs for people with disabilities following new federal legislation. The workshops that provide manufacturing and assembly jobs for people with disabilities are claiming to be threatened by the Workforce Innovation and Opportunity Act, which was signed in 2013 and went into effect this summer. But thanks to the work of disability rights advocates, the era of sheltered workshops has steadily been coming to an end across the country. Sheltered workshops claim to train and employ people with disabilities, but rarely provide the training they need to prepare people with disabilities to gain marketable skills outside of those workshops. Worse yet, many of these types of organizations are found to be paying program participants less than minimum wage under a 78-year-old loophole in federal labor law. Rates may go as low as less than $1 per hour, according to individual measurements of a person's productivity. Disability rights advocates deride sheltered workshops for exploiting the low-cost labor the exemption enables without providing the training services it also requires. In Lake George, New York, a new initiative encourages local government and residents to be more conscious and accepting of people with disabilities, especially those on the autism spectrum. The Lake George Village Board voted unanimously this month for the adoption of the Think Differently initiative for the village, which seeks to implement programs that make the community more accessible. Lake George is among 7 towns and counties to adopt the measure, which includes offering free training to local businesses at the Anderson Center for Autism on how to make their businesses more inclusive and welcoming for those with disabilities. The program also aims to ensure that all law enforcement will have crisis intervention training within 18 months. For more details on any of these trending stories, please visit our website. And please follow us on Twitter at Advocacy Weekly or on Facebook at DA Weekly for updates and our latest episodes. Thanks for joining us, America. For Disability Advocacy Weekly, I'm Monica Petrozelli.